afternoon, everyone, and welcome to today's edition of Black Health Trust. We are so happy to have you join with us in exploring topics of interest and concern to our community. Today, we're going to be talking about the colors of COVID-19, confronting health disparities during a global pandemic. Our guests today are Dr. Stephen B. Thomas and Mr. Omar Neal. Without further ado, we will turn it over now to our founder, Dr. Randall Maxey.
You're on mute, Dr. Maxey. Dr. Maxey, you're on mute, sir. There we go.
Yeah. All right, very good. We have two distinguished speakers this morning. Dr. Stephen B. Thomas is someone who's been with us before, and I'll introduce him in a moment. And Dr. Omar Neal, the former mayor of Tuskegee, is with us as well. Simon, why don't we play our intro song?
Lift every voice and sing till earth and heaven ring, ring with the harmonies of liberty. Let our rejoicing rise high as the listening skies. Let it resound loud as the rolling sea. Lifted.
Thank you very much. Our speakers today are Dr. Stephen B. Thomas. He'd been with us for a number of years, one of the first people I met when we first put together the Black Health Trust. We started out with a Sunday morning round table discussing the whole reason we thought might be the cause of the pandemic. He is a professor at the University of Maryland. He is a professor of health policy and health equity. He is a PhD, and we're going to hear much information from him. Even more than that, he has established a major program of outreach from the University of Maryland to the community through barbershops, et cetera. His associates is Mr. Omar Neal, who is a former mayor of Tuskegee, Alabama. He's a distinguished graduate of the Montgomery Police Academy and has been a foot soldier in the war as a policeman. He's had outreach to teenagers and children, and we welcome both of them. Dr. Stephen B. Thomas, the floor is yours to present your topic.
Well, first of all, thank you very much, Dr. Maxey. And to all of you, I finally got all my tech working, but I've been listening and involved, and I'm just so pleased to see that the Black Health Trust is still here on the front lines, because a whole lot of folks have fallen away for whatever reason as the infrastructure that we saw come together is being dismantled. And so I am also very pleased to have the former mayor of Tuskegee, Alabama, Omar Neal, here with me. And together, we have been on the hell no wall, dealing in our communities where people already had their minds made up. And we want to talk to you a little bit tonight about our method for persuasion and listening and building a bridge of trust. Mayor Neal, you want to add what I have and say hello to this august group of that the Black Health Trust formed right around the same time we did almost 3 years ago.
Well, thank you so much. And yeah, it's an honor to be here hanging out with my dear friend, Dr. Stephen B. Thomas. We call him Dr. T. It's an endearing term for us. We just had Dr. Maxey on our program, The Cutting Edge. And so it was a delight to have him on, and delight to see you again, Dr. Maxey. Yeah, to come and to have this kind of dialogue is very important. I think that oftentimes we think that the issues of COVID have passed us, but what we realize is that when things are out of sight, they are normally out of mind, and then you are the most vulnerable. And so we want to keep people conscious of COVID and what it can be, and so that people can take care of themselves as they navigate through life. And so our work is to keep people conscious about COVID and other things health related. So that's what we do, and I'm excited to be here hanging out.
And so it may be a little bit different than the typical presentations. We don't have slides. We want to give you an experience tonight. And I think one of the things that we can do is let's clear the air and let's get it straight when it comes to the suffering our people have had in the name of science. I'm wearing a Harriet Tubman shirt here. I'm coming to the Dr. Maxey, like the elders, to help show the way to freedom, because I think through addressing health disparities, we can get back that spark we need to get to freedom. So the disinformation engine used the suffering of our people to say to Black people, don't get vaccinated. Look what they did at Tuskegee, okay? Well, as further introduction of the mayor, I want to take you to an ad council piece where the descendants shared what they thought about that legacy. And Mr. Mayor, while I'm going to screen share, if you want to say a little bit more until I get it set up.
Well, one of the issues that took place, particularly when the COVID vaccine was being rolled out, that there was a heightened degree of hesitancy on the part of the African American community. And we found that oftentimes they would invoke the study, the United States Public Health Service study that was conducted in Tuskegee, as the reason for their hesitancy to get vaccinated. And what we recognized is that it was taken out of context. You see, I'm a descendant of three people in my family were a part of that study. My great uncle, my uncle, and a cousin.
Now,
And
Mr. Mayor, I'm about to set you up with that. Do you see a full screen?
I see a full screen.
And then on the other side, I want you to continue. You ready?
You're ready to go.
Here we go.
My uncle, Freddie Lee Tyson, was a part of the syphilis study. He was such a wonderful man, a very loving, very caring, very jovial person. He helped build the air base at Moulton Field. When you think about the Tuskegee Airmen, all of the greatness that they did, and then in this same space, such an atrocious study was being heaped upon our men, that really shook my spirit. They were not being treated. That is very different from what's happening with COVID-19. The vaccine is being made available to anyone who wants it, even those who find themselves at the space of hesitancy. We have to have patience and give them the requisite information that they need, that they can make an informed decision. But let's do it out of love.
Okay, are we back to the Hollywood squares? Yeah, let's go ahead and snap that up, because I mean,
Yeah.
if you've seen it, you need to see it again. And if you've not seen it, you have to say, why? Why? Because it's still being used to distract us. So, Mr. Mayor, you are elaborating on the fact that this is your family.
Yeah. Yeah. And it really hurt to know that people were jeopardizing their lives based on a false equivalent to what was happening with COVID and what happened with the United States Public Health Service study that was conducted in Tuskegee on my family. You see, the problem is my uncle, my great uncle, and my cousin would have loved the penicillin. They would have loved to have taken the vaccine,
Yes.
but they were denied it. And so when people say, I'm not going to take it because of Tuskegee, I tell them, man, you doing to yourself what the government did to my family,
Yes.
right? It wasn't what they did, it's what they denied, what they withheld from them. And so I said, well, what we have to do as family, we have to be more vocal about making sure people understand the true story that took place, and how people need not to use Tuskegee as the reason for them not getting vaccinated. So we did one of the largest ad campaigns that's ever done by the Ad Council. And so that kind of proliferated not only in this country, but we did campaigns around the world. And so that's kind of where we are on that.
Now, we're going to open up in just a moment. But Mr. Mayor, I want you to tell this audience, what is the official name, so that when we're out there, we can make corrections and get it right?
The United States Public Health Service study of untreated syphilis of Negro males.
Okay.
And that's it. So it's untreated. It was not a therapeutic study. It was merely a study to see what the long-term effects of syphilis would be. And so they allowed those men to live and to cohabitate in the community, spreading syphilis throughout the community, to infect their wives. There were children who were born defected as a consequence. Men died as a consequence of syphilis when the penicillin was readily available would have been readily available to them. And what makes it even more egregious is that when those men sought outside treatment, they blocked them. They did not allow other physicians to help them. When they tried to sign up for the military, they told the military that they were part of a study and that they could not go into the military. And they didn't know why they could not serve in the military. And they didn't know why people were shunning them, only to find out that it was an organized, orchestrated effort to deny them treatment and watch them die and to suffer over a 40-year period from 1932 to 1972.
Now, the last part of the table we want to set tonight for our discussion has its roots right there in what the mayor just described. The atrocity that we all knew that took place. There was an apology, 1997. We'll talk a little bit about that. But the pandemic was an opportunity to show what it might look like, to reimagine taking action. And in our case, it's in the barbershops and the beauty salons. I want you to go inside and meet some of the new warriors on the front line. Do you see a full screen, Mr. Mayor?
Full screen.
Here we go.
If they could come up with something for the coronavirus in 6 months, hell, cancer been out for 60 years. How come they haven't came up with something for cancer?
These are viruses. They just take their course and they're going to run. You can't stop them.
Mike Brown is a barber stylist.
What cancer and the coronavirus got to do with anything?
And a certified community health worker.
Bless you.
Hope I ain't give you the virus, Mike. You vaccinated.
I'm vaccinated, but that won't stop me from getting it.
You wearing your mask?
No question.
They said if you've been vaccinated, you don't have to wear the mask.
For months, he's been encouraging his clients to get the COVID vaccine.
You can't not get in my chair and not know that I want you to be vaccinated. I mean, it's all over my station. Because I turn everybody to the mirror for the shape up to see if it's straight. And when they look, their eyes always wander. Or if they're not looking, I like switch the chair to here a little bit. So you'll look and ask the question.
Brown is part of a larger program called HAIR, aimed at bridging the gap in healthcare advocacy by tapping into the established relationships between barbers and their clients.
What happens in the barbershop is where social norms are set.
In a pilot program, the University of Maryland and Luminous Health turned this barbershop into a vaccine clinic.
Now we're down to the last mile neighborhoods, the last mile communities, and you got to do things differently. It's not about volume.
We probably have vaccinated around 20 individuals, so it's small numbers, but those are 20 people who a couple of hours ago weren't vaccinated.
Brown sees this as the final stretch, where misinformation and distrust are still keeping some members of the community wary of getting the vaccine.
I think we weeded through the people who were on the fence. They've taken the position to get vaccinated. We're at the wall where people are saying hell no, and it's a difficult task. I can understand somewhat of a distrust, but it's a worldwide pandemic. The world is doing it, so they're trying to stop the world from reproducing. They're trying to put a chip in the world. They want to follow everybody around. I mean,
program leaders say providing convenient access to the vaccine will go a long way in closing the disparity gap.
So the access issue is really making it available, places where they come so they don't have transportation issues, no appointment necessary so they don't have to worry about how am I going to fit this into my schedule, how do I figure out how to get on the schedule, but basically just saying, hey, we're going to be here for 6 hours, show up.
And the hope is to expand this concept to other barbershops across the country.
if we did that in every barbershop where they allocated funds to every barbershop to do it on their off day, oh wow, that would be awesome. And so many communities would be reached. To chip something away from the hell no wall is everything to me. If I could chip one away from people who saying hell no, you keep fighting. You keep fighting. Maybe you get 2 or 3 the next time.
So let's give a little snap to the barbers out there who are looking and saying, you know, wow, we got some new skills, we're being recognized. And the mayor and I are coming to you to say that the very infrastructure that allowed us to do that, to capture the attention of the White House, to scale this across the country, we now have over 1,000 shops across the country, that the very infrastructure to create that is being dismantled right now. Those clinical partners, I can't get them to come out anymore. So I said to Dr. Maxey, we're coming to the Black Health Trust. We're gonna have to do this ourselves. And so these bars, poles back here, are not just a background, they're a metaphor for getting our people to freedom again through health. We're going to be polarized on a whole lot of issues out there. But who can be against ensuring that a Black baby lives in the first year of life? Okay, we can pick our points of where we want to plant the flag. But the mayor and I are here to tell you that we have an army, like the barber you just saw, and they're waiting for their marching orders. They want to talk about type 2 diabetes, lupus, all kinds of cancers, and translate it into a form they can use right there in the chair, one by one, saving lives. So, Mr. Mayor, Dr. Maxey told me that we have a tight time schedule. I think we're still on time. We've now set 2 ends of the table. The moral authority comes from, I think, the atrocities. And an apology means I'm sorry. And that came from a president who wasn't even alive in 1932. We've got to move towards atonement. And that means making things better. And the pandemic I think, allowed for a glimmer, a silver lining of how we made things better, how we actually moved the needle. We had people coming in from under the bridge, people who were not housed. They came hesitant, Dr. Maxey, and they left hesitant, but vaccinated. We fed them. There was a DJ. We treated them with dignity and respect. We didn't have to change anyone's worldview. We know now that they're listening. And we're here for your help and a partnership moving forward. Mr. Mayor, before we turn and open up the floor.
You know, I think that the salient point is it's not just the message, it's also the messenger. And I was always taught that you make your friends before you need them, that people who already have relationships are better messengers to people when they are looking for trusted information. And what happened is to equip barbers and stylists. You know, in fact, we are on with physicians. Barbers and stylists spend more time with their clients than you spend with your patients, right? They see them more frequently than you see your patients normally, right? And so the point of the matter is those relationships are established and they are rooted in trust. Because if you can get somebody to cut your hair or fix your hair right before you go into some significant event, you surely trust them, right? And so
Hey,
trust is
Mayor,
already
and
established.
don't matter how much hair you have too, right?
That's exactly right. You know, so the point of the matter is, so trust is already in place, and that's where we needed to start, in
Yes.
spaces where people had already established that trust, that kind of, you know, that bond that exists already between those institutions, the barbers and the stylists and the communities they serve. And so that was the angle, and that continues to be our focal point, is to infuse information into institutions that exist, that can sustain that information, because the barbers and the stylists will always be there. They've always been there. And so if we can inculcate information into institutions that are stable, then we can have a sustainability of health for our people. And that's the focus.
And be mindful, these are not nonprofits. These are small businesses. So now let's start thinking small business. Where's the Small Business Administration? Where's the local chambers of commerce? What's the infrastructure, if it exists at all, for these barbers and stylists? You know what we're hearing? Number one, they're calling themselves wellness warriors. That's a good thing, because they're being certified as community health workers in their various state jurisdictions. We're training a whole cadre of them to be registered lifestyle coaches, certified to do the diabetes prevention program. Hey, physician, now you have a partner in the community to help reinforce your message. Because messages are being delivered anyway. We're increasing the likelihood that those messages can actually save lives and actually they be a better partner with their provider. And so with that, Dr. Maxey, I think we're right up on that time you gave the mayor and I to set the stage before you wanted open discussion. Mayor, let me say thank you so much for joining me here today.
Always a pleasure, my man.
I think that this brain trust that we're among can really help us look beyond both the challenge and the opportunities we have ahead. Dr. Maxey?
I think the two of you have been very forthright in what you presented, and it should have sparked a lot of interest for discussion. And I certainly believe that the barbers and the beauticians are key parts of our community. And one of the things that you brought up is that of being compliant to good medical practices. Most of our audience are lay people. We do have some physicians on with us. But I'd like your comment on how do you convince people that the medicine is good, it's not snake oil? And I don't mean just the vaccine, but your insulin, your blood pressure medicine, your diabetic medicine, and the other things that can prolong our lives. We know that many people suffered from COVID more than they had to because of obesity, because of high cytokines, because of COPD and asthma. What can we do to have our people be more serious about taking care of their own health and their bodies? How can these health workers help us?
Well, let me share an observation from the perspective of trying to implement those kinds of programs, and then I'll throw it to the mayor. Here's what we learned. You know, the pandemic was like a stress test. All these other chronic diseases we've been working on for all the way back, Dr. Walks talked about HIV/AIDS. Okay, we've been here for a while. You know, from the creation of the Center for Minority Health at NIH all the way to an institute, many of us seen that whole arc, huge, and yet our people still suffering. So the pandemic really was a stress test to innovate, and the resources allowed us to take time to listen. That was our approach. So I'll give you something right from the barber's chair. Mike Brown says to he says to one of the customers, everybody in the world is trying to get the vaccine, and that's the plan A, to keep you from dying, and you don't want to take it. What's your plan B? And he says at that point, there's no more arguing about chips, no more arguing about people listening to me. It's quiet. And it's 2 weeks before the guy comes back and says, are you guys still doing that clinic? It's relationship building. I think we have to have much more patience and not look down on people. So that's one message, Dr. Maxey. We have to be in for the long haul. We're operating as best we can as the resources disappear to continue the engagement with the network. And that's where the mayor comes in, about the conversations we're having with them, so that they know where their line is and when they need to ask for help. And then we want to be there, because we've turned the corner now. Now they're asking for help on cancer, asking for help on lupus, asking for help on all these things. And we got to be there for them. Mr. Mayor?
Well, you know, part of it is that people have to trust you. And I reiterate that because that's critically important. And when they go to hospitals and clinics now and are disrespected or ill-treated, it reinforced this notion that this institution does not care about me. And until we can change the implicit bias that's within the medical industry, until we can have customer service, oriented service to all people, regardless of their economic or social status or their ethnicity or whatever, until we can have an infusion of fairness and equity within that system, it's going to be difficult to get people to trust that system. And that's where people like yourself and others come in, that you have to challenge those systems within to make sure that if something is going wrong and that you see disparity in treatment, that you call it out. And if you are able to do that, then we'll know that we got an ally inside.
Right.
But if we see that you know what we see and you say nothing about it, then I don't trust you either.
And so, you know, our friends inside, I'm just going to say the belly of the beast, because the pandemic let them come out. And you know, when they came out and delivered those services in the barbershops and the beauty salons, they loved it. They were like, this is why I became a physician. This is why I became a healer. But those same systems are saying, when we now make that call to come back for those other Pre-existing conditions. Oh, Dr. Thomas, we don't do pop-ups anymore. The grant's over. I'm saying the grant's over, but what we did work. Where are you going back to? What didn't work? So I'm saying while we're waiting for that big system, to fix itself, and in Maryland, I do think we're going to have some real opportunities for innovation here. There's something we can do right now. Barbershop, salon, one at a time, if that's what it takes. Because I think it's giving us good intelligence for how to actually reimagine the healthcare delivery system and how the barbershops and salons in our network can be training sites for health professionals, urban immersion, give them a rotation right in the hood, right in the barbershops and salons. And so with that, Dr. Maxine, let me throw the floor back to you, or Dr. Walks for—
Dr. David Stevens.
Thank you so much, Dr. Maxey. And Dr. Thomas, I think that you have put out some provocative thoughts, probably not in the direction that you were throwing them, but nevertheless needed. Because as I've been sitting here thinking, I've had several reactions to things that you've said, but one of the towards the end, one of the comments that Mayor Neal made was, and I'm paraphrasing a little bit, that if you're not getting the customer service that you need, well, implicit in that statement is something that I think is probably near the heart of the whole problem in the first place. And you may be surprised. I have an MBA, and I'm not against business. However, I definitely do not believe that the relationship between a physician and a patient is a business. And when you start using terms customer service, I think you're getting off the track right there, because it shouldn't be a relationship that's a customer. At least that's my opinion. Now, there are a lot of physicians now that find themselves, because of the nature of the healthcare industry, in a situation where they are in a business and they are not practicing medicine. They are working in a business. So I think that we've got, not that I'm not trying to get us off track here. I'm not trying to say divert attention from the barbershops, but I think what you're calling out is so systemic that I don't want us to miss that, because I think that is something that, again, if it's known, then we need to figure out how we're going to manage it. Yeah. I guess there's not a question in that, but so my question would be, what would be your thoughts around those comments?
Well, one is, if there's a fee for service, that is a business, whether or not you see it that way or not. We pay physicians for services, and they provide services. And doing those services, they have a way to treat you. And then when you walk into a business, or walk into a clinic or hospital, whatever, it's an establishment by which a relationship is established, either whatever you like to call it. I don't have a preference in terms of what you call it, but it's a relationship. It was Maya Angelou that said, people will soon forget what you do or say, but they will never forget how you make them feel. And if I walk into a place and I feel a certain way based on how you talk to me, how you treat me, even the length of time I have to wait before you can even acknowledge me, right? All of those things compute, and I formulate an opinion as to whether or not this is a trusted place or a good place for me to be. And I'm saying that hospitals and healthcare facilities all over this country have demonstrated that there is a disparate treatment between people of color and other people. And if they recognize that there are people within those institutions that are not trying to correct that, then it's difficult to trust those people as well. And that's all I'm saying. That was the point I was making.
It's interesting. Mayor, is we're talking, and I know we have some hands up. We have a system, so we have some structural issues that have to be dealt with. Then we have the individuals in those systems. And so, Dr. Nesbitt Stevens, what I saw was the health professionals finding their heartbeat back, finding another way of reaching the people that they wish they would reach before they end up in the emergency room. They loved it. They were they were refreshed by it. And now the barbers and stylists are putting on their own workshop, a love letter to the clinical partners who came into their shops to deliver that life-saving vaccine. That's a huge turnaround. That's what trust and trustworthiness looks like on the front lines. I'm not sure who's doing the questions and answers, who I'm throwing the floor back to.
I'll do it.
There's some hands up out there.
That's Walks.
So first of all, Dr. Thomas, my brother, thank you. This is an excellent area of focus for us. Mr. Mayor, we appreciate you coming and being with us. This area matters to me a lot. When I was doing my psychiatric training, I did a 2-year fellowship in transcultural psychiatry. And of all the things I forgot, what I remember is that if you're going to go into a community, go with somebody. That worked when I was walking around on 28th and Budlong. You don't want to go in there by yourself and don't know anybody for safety reasons. And if you want to have an impact, you go with somebody who's known in the community. So I love 25,000 times more this approach of bringing, as we used to say back in the neighborhood, bringing the mountain to Muhammad. You want to come with what the neighborhood needs to the neighborhood. And I could talk about this for a long time, but I won't, because I think it's important for us to acknowledge the folks who have been putting their hands up and who have some questions, and I'll save some other comments for later. I don't know if Dr. Hines has anything she wants to lead with, but I know Dr. Sherrod and others have hands up.
I do have one question / comment, but first, thank you very much. I love the idea. To your point about finding the heartbeat, being in the community as a family physician, doing the work that I would do in the communities was where I was most enthusiastic. But one of the things that I have a question about, if you could expound upon, is the training and that setting of the community healthcare worker, because when you're looking for partners and we're talking about trust, sometimes the issue gets to be you've got doctors on the one hand saying, hey, we're who you have to trust because we're the only people that know what we're talking about, right? And then, and sometimes that is appropriate because sometimes the same people who we say, hey, trust my influencer over here because they're saying the message that I want them to say, and then right out the other side of our mouth, we'll say, hey, don't trust people who aren't medical people because they're not medical people. So for the average person, it's hard to figure out who I should be listening to. So I just wanted to kind of see how you frame that for folks.
Well, go ahead, Mayor.
One is one of the things that I think is important, I think is both and rather than either or. The public health workers are not physicians, and so they are not qualified to do what physicians do. What they do is they sensitize people to the need to seek treatment and to seek help and to take ownership of their own health, right? And I think that's where the nexus is between them saying, okay, there are people who literally are going through things, they're self-medicating, they don't seek out medical care early enough. That's why we are finding people coming in with these advanced illnesses and diseases, is because they wait to the last minute till they can't wait any longer to come in. And what the physicians, I mean, what the barbers and the stylists can do is can tell people, go early, because the earlier you detect and can diagnose something, the better the prognosis is in terms of treatment. And that's what we're talking about, not replacing the physician, but merely to sensitize people to taking ownership of their health.
And removing the shame. We've got people sitting in the barbershop that were alive because they had a heart transplant, had a liver transplant, but there's a certain shame. They're not even talking about that. And now we're wondering why we have hesitancy around organ and tissue donation. So here's the other thing. We're listening. And when we hear something, we have to act. One of the barbers said to me, he said, Dr. Thomas, they said, Dr. T, you want us to be a epidemiologist, an endocrinologist, and a microbiologist all at the same time? That's how the COVID information was coming out. He said, you know what, you got to break it down like you're talking to an 8th grader. We took that to heart, and we brought in some artists, and we turned our qualitative research findings into a graphic novel. It's called The Barbershop Storybook. And the first 2 books are out. And we would love for the Black Health Trust to do a review of these books and help us with some new themes. Because when the people open up the books, you know what? They see themselves. And then you know what they do? They run back and tell others. I think this is how we reimagine how we interact with the healthcare system, by bringing it into places where people already have trust. And we would like to, well, I better be quiet here. I see more hands and people turning their cameras on. That's good, because the mayor and I wanted to spark a conversation. All right, Dr. Wilkes.
So let's go to the chat, Dr. Walks and Dr. Stevens, Dr. Hines.
Can we unmute either Dr. Sherrod or Ms. Fowles?
Dr. Sherrod?
Oh, good afternoon. Yeah, let me just thank Dr. Thomas and Mayor Neal. I want to call you all the Dynamo Duo because the information you've shared has been very valuable. And, I understand the importance of the barbershop and the salon and spreading information, and actually health information, and encouraging people to take responsibility for their own health. And that's something that we really have to push home in our community. I also want to commend you on differentiating the difference between what went on with COVID and the Tuskegee study. It's true that, they were withholding therapy for treatment of syphilis, but, I hate to dive deeply into the COVID pandemic and all and what went on with that, because there was a form of withholding of treatment because we could not utilize any treatment in order to get to experiment with the emergency use of the COVID vaccine. So as a result of the withholding of treatment, which of course disproportionately affected our community, and actually there's a big lawsuit now for the number of lives that were lost because of the withholding of quote unquote traditional treatment, like the medications that have been demonstrated to work. There's a big lawsuit of crimes against humanity because so many lives were lost while they were trying to get emergency use of the COVID vaccine. And it is true that it was a choice. You had a choice to choose the vaccine or not. But then there was a little contingency to that, and a lot of misinformation going on in that if you chose and decided, now it was your right, supposedly, quote unquote, if you decided not to take the vaccine, then you were labeled as anti-vax, and then you were put into the category that you were spreading the illness. And so those are the kind of things that are in the undercurrent, and that's the similarity between the trust of the system and what went on at
Tuskegee, because in essence, it went on with COVID on a different level. And this was the first time in the history of medicine that we've had physicians told not to treat when they didn't have a, quote, defined therapeutic regimen, not to treat with whatever that worked until they could find what really worked. This is the first time in the history of medicine that we've had that too.
I can take some issue with you, Dr. Sherrod. And I know you come from the August University at Harvard, but what we've done on this program is agree as a group to deal with evidence-based medicine. And even though a lot of traditional things have been recommended, in reviewing the majority of the research that has been peer-reviewed, evidence does not point to the success of some of those traditional treatment, whether it be ivermectin and some of the other things. So we've done all the reviews. We've met with the National Medical Association, the American Medical Association. We met with the CDC. We've met with the FDA, and the preponderance of the people that we've had on our advisory is that even though there have been some miscommunications out there, that we want to support the evidence-based medicine. And by and large, evidence-based medicine is what we believe has saved the day.
Yeah, Dr. Maxey, I'm going to cut you off because you cut me off too, but I just want to say I understand where you're coming from, but I think it's important to make clear and be transparent about the whole process. And that's all I'm trying to do, is to make them understand the transparency of the process, because in our community, there was a lack of access. People were going to the emergency room. They were being sent home and told to stay home until they couldn't breathe. You understand what I'm saying? So the education was on our part that there are things you can do to treat COVID even before the vaccine came out. This is what I'm emphasizing. And I just want to say too, one other point, and then I will get off, because I know I create questions that people don't want to talk about. But anyway, the other thing I want to say is that I'm kind of forgetting because I'm getting a little bit, we still have the problem of being able to have our system be completely transparent about the whole process of the COVID pandemic and the development of the vaccine. And all of this stuff is in the press, so people know about it, that there are still questions being raised concerning that. But there was another point that I was going to make, concerning the business of medicine. We know now that medicine is a corporation. Medicine has been corporatized. It's not like it was when back in the 70s when we came out of medical school. So it is a business. And that's the other thing we have to realize, is that it's not about healthcare and the patient anymore. The bottom line is, how much money can you make? And so we have to face that in order to erase that. And those are my comments. I'm sorry.
Okay, thank you for your input, Dr. Sherrod. One question, when I was first got into practice, the physician that I worked for, who was one of my classmates, he had a sign in the office, and I don't know the exact percentage of Black physicians there are, but out of the several million physicians that are available in the United States, there are probably less than 3% of them happen to be Black.
4%.
We know.
Okay, and the statement he made, be patient. So one of the things I want to ask to Dr. Thomas and Mr. Neal, we know that the percentage of Black physicians and even Black-like physicians who may not be Black but have empathy for our race, we're not enough. How do we get an increase in that number of sensitized physicians to take care of our people in a genuine way? That's always been a concern of mine.
Well, let me just start just as the academic, and that is there are a number of pipelines, and I can go through the national mentor research network, things set up by the National Institutes of Minority Health Disparities. Some are institutes. All these things are in place, and yet what the pandemic has taught us is not enough, especially if once people who come into the system get diagnosed, maybe even have a prescription written for them, and then come back into the community and are surrounded in an environment that says if you do that, you're not part of the community anymore. Some of our providers have no idea that people are coming into that's what they're going back to. We had a grandmother who was eligible to get vaccinated in the first wave. She was very late getting vaccinated. And she said, I'm not going to tell my family I was vaccinated, because she was going into a household where people didn't believe in that. So I think we have to have spaces where the conversation about taking charge of your health is occurring before you're in the healthcare system, before you're in the ER. And the pandemic helped make that happen. And what we're trying to do now is to keep that conversation going, and coming here and meeting all of you and having the expertise here in the Black Health Trust to share and through the network would be a wonderful way of leaving something positive behind as we move forward.
Thank you so much. There's some more issues in the chat, and I know Dr. Wanda Johnson was asking me about when is Dr. Stephen B. Thomas going to be on. So I don't know if she's available.
So Dr. Maxey, Miss Fowles has had her hand up for quite some time, waiting to get in, and she is now unmuted. Please.
Okay, go right ahead.
Good afternoon. It's such a pleasure to have both Mayor Neal and Dr. Thomas on the line. I would like to take something that Dr. Thomas said earlier, and also the statement, part of the statement that you made just now about doing things for oneself, that we need to do stuff for ourselves. The point that you had raised about the testing and making people comfortable with the concept of the vaccines and clarifying that thing that Dr. Sherrod talked about in terms of the Tuskegee situation. I think that what I am interested in and what I have been trying to do on my end, I'm in Berkeley, California, and Dr. Sherrod and I went to UCLA together for MTH, so I know her very well. But I really think that we have not looked at the possibility of doing our own research in terms of clinical trials, in terms of expanding how we maintain health, not only using the allopathic medical model, but also using the naturopathic preventive model, and fusing those modalities so that we get the benefit of all of it. And we have in our culture as African people, herbologists, we know the use of garlic in terms of the aspidity bag, you know, it smelled so bad that nobody wanted to get near you, so that you actually got rid of the cold before you got the cold, because nobody wanted to come close enough to you to even spread it to you. So I think that there are two issues that I'm raising here. One is, I need to know how you managed to fund, and Mayor Neal, you may be able to answer this question. How did you manage to fund the barbershops and the relationship, the financial relationship with the health department to give them the money so that they could, you know, provide this information and become a hub of pro-vaccine issues? And the second part is, where do I go to get money to do a clinical trial using matched populations of vaccinated and unvaccinated people in the African-American community, what's left of it in South and West Berkeley, West Oakland, et cetera, and trying to do something to give them a balanced knowledge of what you can use as antivirals in the herbology compendium, and in the allopathic compendium. And then we have populations that cannot take vaccines of any kind because they will go into anaphylactic shock or some other thing that would damage them for life. Those are the populations that we haven't even discussed in terms of African people who can't take vaccines at all, whether it's, MMR, whether it's DTP or whatever, DTaP or any of the other ones, hepatitis and so forth and so on. And so those people have been completely left out. They haven't been given any herbological, naturopathic, anything. In fact, I have gone on Radio Pacifica, KPFA, here in the Berkeley area to talk about when are we going to see somebody say something about D3, which is a natural antiviral? When are we going to say something about elderberry tea, natural antiviral? My question is, how do we fund this? How do I get money to fund this and do a clinical trial? And then the other part was, how did you guys get funding to go into the barbershops? Because my degree is in public health, fiscal policy, finance. Where's the money?
Let me just say this.
Shift that ball to Dr. T.
Yeah, let me just say, and I'm gonna shoot it back to you, Mayor, as
Okay.
a policymaker,
Right.
over city budgets and things. But I'm just gonna say this. Wow. Okay. What you've done is just simply set the stage for a whole line of discussion, policy implications for how we reimagine delivering care in our communities and how we respect. And a lot of the folks sitting in the barbers and chair talk about these things, elderberries. They talk about nature. They talk about weed like it's a natural thing rather than a medication pharmaceutical. So if you say, do you smoke? Yes. Smoke what? So that should be part of our conversation of how we help them navigate a very complex situation. We're having NIDA, Dr. Walks, come to us now and say, we like what you're doing in these barbershop networks and working with the communication experts like Mayor Neal. How might we ensure that Narcan training is available to them, just like CPR training would be available, and that the Narcan kits are available in the barbershops? Those things are now coming to us. And that's why I think that working together, we are stronger. As 501, hey, Mayor, I'm gonna throw it to you before you throw it to Dr. Maxey, because they're gonna run us out of here.
Yeah, I see.
No, we're not.
We have extended our. We don't want to over do our stay. But let me say this: I'm appreciative of the question. The point of the matter is, I've come to realize that nobody can save us but us, right? And even with financing our own research and whatever it is we're doing, we're going to figure out a way to do that. We have been, I think when we first started out, Dr. T had this concept of no research on us without us, meaning that we needed to be at the table for all research, and that we would be a part of clinical trials because of what the benefit it is to our people. But yet again, if you look at what's happening with the federal government, they have withdrawn most, if not all, of the dollars for COVID relief. And so we cannot wait on people to fund us. So we have to figure out ways, and Dr. T has been able to go into the area of philanthropic areas or companies and businesses that see a benefit for what we're doing. But ultimately, we got to figure out a way to use our invisible capital and to galvanize resources to take care of ourselves. We can't wait for other folk to do this. It's something we got to do ourselves.
Mayor, that almost sounds like those T-shirts I used to see as for us, by us.
You're right.
I think we have to take point definitely on that. And I will say that, Cigna has been we have a number of partners, but I'll mention Cigna because they were there when nobody else was around the colorectal cancer screening. And they're still with us to this very day. And so to have a payer watching and interested in something like this, I think bodes well. And so I think, and we hope, the mayor and I hope this is the beginning of a longer conversation, and also to bring members of the Black Health Trust to the cutting edge.
And vice versa. We like this. And I'll announce to everybody that Dr. Thomas and I have been discussing the nature of a potential relationship between the cutting edge and the Black Health Trust. And hopefully we'll get Dr. Neighbor-Stevens, Dr. Hines, and Dr. Walks on the phone with us within a few days, and we can discuss how to do that. But we're at the top of the hour, or a little bit past. I'd like to ask Dr. Thomas and Mr. Neal for brief final comments before our moderators. Thank you very much.
Mayor, I'll let you go and I'll close out.
Okay. One is, I think words are inadequate to describe what a pleasure it has been to engage in this kind of authentic conversation. Obviously, we all are possessors of some truth, and as we bring our truths together, then and only then do we get closer to the truth. So although we may differ a bit on pathways, we do have a common goal, which is to save our people. And so I'm appreciative for your sharing your thoughts in this area. The ability to communicate to people is critically important. And that's what the cutting edge has done. It's created a platform by which we have an ongoing dialogue with the particularly communities of color, but anyone can tune in. Our focus is giving people information, believing that when people get the proper information, they naturally gravitate to take care of themselves. And so I thank you so much for sharing with, allowing us the opportunity to share with you. And we look forward to seeing you again. Dr. T, up to you.
Well, I just want my, I call you all scholars to know, I'm standing on some big shoulders here, including Dr. Maxey's shoulder. I call him the Godfather, but I'm standing on the other Godfathers of David Satcher, John Ruffin. Okay, he grew a lot of us. We're out here now in positions to make things happen. Okay, so I'm still in the academic space. How might the University of Maryland's Center for Health Equity in the great state of Maryland, be an academic arm around which we can build something, including training pathways and find funding opportunities as well. So our motto is building bridges, building trust, building healthy communities. And I think we can do that doing the little things while we can, while we're trying to do the big things. If the pandemic has taught me anything, is that the little things can get big things. And that's what we're here for the long haul. And that's why I just love what Dr. Maxey has done with the Black Health Trust. We got a one-stop place to come for all the information that we need for our community to take charge of their health. And with that, I just want to thank you so much for your time this Sunday and turn the floor back over to the Black Health Trust. Thank you so much.
Thank you. Thank you so much. Dr. Hines, Dr. Walks, and then Dr. Neighbor-Stevens.
Again, I just want to thank you both for speaking and for bringing to the forefront a way that we can build better together, right? Like just, be community and exemplify that. And what's resonating with me that you said several times, both of you, there were multiple nuggets in there, but around listening better and empathy and listening with empathy. So I just really thank you and looking forward to new ideas on how to be parts of the community together.
Thank you.
So Mayor Neal, Dr. Thomas, just really appreciate so many times when we get together, we talk about all the things that are wrong and all the things that are problems. And it's good to hear a couple of brothers come with something that has been demonstrated to work, has been demonstrated to move our thinking and our practice in the right direction. There was a comment in the chat about the non-MD people in the entire health continuum. And there are a lot more that are not MDs than there are that are MDs. And I just appreciate the embracing of all of the folks in that public health sphere in the work that you do, and bringing the barbers, the salon folks, everybody into it. One thing I will say in response to well, two things. First one is, this is an opening of a much longer and richer conversation about how we take charge of ourselves and our health and our community. Second thing is, the money for COVID is not going to be there because everybody is deciding that COVID used to be there, even though it's killing a lot of people every day. Still, at the same time, as a former public health official that had to spend $1 billion every year on healthcare and healthcare projects, there are other people younger and less gray than me who still have budgets at the state, the county, and the municipal level. And get to know those folks, get to know them, tell them a good story about what it is that you want to do with some of that money, because they want someone to be able to go all around and talk about the good that was done with that money.
Yes.
The federal government is one funder. It is by far not the only funder, and may not be the best accessible funder. So I say, when we have great ideas like what Dr. Thomas and Mayor Neal and others have, go to your local areas, buy those books that Dr. Thomas is holding up, learn how to use things like that to communicate, make a difference, and then go say, hey, look, y'all gave me $10 and this is what I did with it. I'm back now to get 20 or 30 or 50. That's what I got, Dr. Maxey.
Thank you.
Thank you.
Tennessee.
Well, actually, it's Florida today. I want to, first of all, thank both of our guests for coming on today and sharing with us the good works that they are doing and how they exemplify what I have been advocating from the very beginning, that we have to take charge of our own destiny and work to improve our own destiny and not just sit back and gripe. And I think that we need to give them all of the accolades that they deserve for getting out there and doing what they can do. The other thing I want to comment about today, and most of the Sundays, is that the conversation about what ails us and what needs to be done for us needs to be done by us. And I hope that our audience understands that we don't know where our reach goes, but I am confident that we are putting out there the seeds that need to be planted to help us to take control and I understand what needs to be done and implement what needs to be done. And I look forward to us continuing down that path.
Thank you so much. Is Dr. Rhonda Johnson on by any chance, Dr. Wilkes?
I do not see Dr. Johnson on at this time, Dr. Maxey.
So that means, Dr. Thomas, you got to come back. She wrote me emails saying, when are you going to be on? And anyway.
I'd be honored.
Okay. So this was a wonderful program. I do want to bring up that we are about to have a much improved, I believe, website for the Black Health Trust. So it will give us more ability to share what we do and information. And we haven't asked for money for a long time. So I'm going to put back up that request that we're going to need your support for some of the things that we have going forward. And we will have a donate button. In the meantime, checks can be made out to the Black Health Trust. We are a 501c3, and I'll have information when we come on next week. And COVID is still out there, and there's information that says that if you've been vaccinated, if you've been boosted, your chances of long haul syndrome getting really serious may be less. And we'll talk more about that in the weeks to come. The other thing I want to turn to in coming weeks is that of precision medicine. We know that so much of our ills are caused by genetics. We want to talk about the genetic things that can put us in harm's way, regardless of what we do with our current look at medications. So everybody have a great, great Sunday. Enjoy yourself. Thank you, Simon. Everybody have a great day.
Good day,
Bye-bye.
everyone.
Thank you so much.